Menstruation. The menstrual cycle is the regular natural change that occurs in the female reproductive system, specifically the uterus and ovaries, that makes pregnancy possible. The cycle is required for the production of oocytes and for the preparation of the uterus for pregnancy. There is shedding of the superficial layer of endometrium. The cycle length ranges from 21 to 35 days normally and averages 28 days. Menarche, onset of menstruation. Premenstrual syndrome, the occurrence of somatic, psychological, and emotional symptoms that occur in the premenstrual phase of the menstrual cycle and resolves by the time menstruation ceases. Menstruation disorders, menorrhagia, metrorrhagia, polymenorrhea, oligomenorrhea. Amenorrhea. Menorrhagia. Menorrhagia is an abnormally heavy and prolonged menstruation 80 milliliters flow, usually accompanied by clots. It may occur in girls close to puberty and in women nearing menopause because of anovulatory cycles. Metrorrhagia. Metrorrhagia is bleeding between menstrual periods. It is normal in some adolescents who have spotting at the time of ovulation. Middle staining may also occur in women on hormonal contraceptives. Breakthrough bleeding for the March 1st or 4 months. Vaginal irritation from infection might lead to mid-cycle spotting. If metrorrhagia occurs for more than one menstruation cycle and the client is not on hormonal contraceptives, she should be referred to physician for examination, because vaginal bleeding is also an early sign of uterine carcinoma or ovarian cysts. Polymenorrhea, excessive bleeding and the length of the cycle is reduced. Cycles with intervals of 21 days or less. Oligomenorrhea, infrequent menstruation and is usually defined as occurring when the duration of the cycle exceeds that of normal for the individual. Infrequent menstrual bleeds for more than 35 days apart. Polymenorrhagia, shortening of menstrual cycle with heavy bleeding. Amenorrhea, the absence of menstrual flow for at least 3 cycles in a woman having a regular cycle of menstruation. It could be primary or secondary. Primary amenorrhea, the absence of menstruation for a girl or woman who has reached the age of menstruation, who never menstruated. Secondary amenorrhea, the absence of menstruation for a period for a woman who has menstruated previously. It may result from tension, anxiety, stress, fatigue, chronic illness, sudden weight gain or loss, or strenuous exercise. Absence of menstruation for more than 6 months. In a normal female of reproductive age and not because of pregnancy. Dysmenorrhea, painful menstruation. Primary dysmenorrhea is thought to be caused by excessive levels of prostaglandins, hormones, that make your uterus contract during menstruation and childbirth. It is since onset of menarche. Secondary dysmenorrhea describes painful periods that have developed over time and usually have a secondary cause, i.e. PID and endometriosis. Menopause, the woman's final menstrual period between ages of 45 and 55 years. Perimenopause or climacteric, time of life from the onset of ovarian dysfunction until 1 year after last period and the diagnosis of menopause is made. Intermenstrual bleeding, bleeding between periods. Postcoital bleeding, bleeding after intercourse. Postmenopausal bleeding, bleeding more than 1 year after cessation of periods. Pelvic inflammatory diseases, pelvis inflammatory disease occurs when there is ascending infection from the endocervix to the higher reproductive tract. IT is a recognized complication of chlamydia and less frequently gonorrhea. Heterotopic pregnancy, it's the simultaneous development of 2 pregnancies, one within the uterus and the other outside uterus. Gestational trophoblastic disease, spectrum of conditions that includes complete and partial hydatidiform mole, invasive mole, and choriocarcinoma. Hyperemesis, excessive pregnancy-related nausea or vomiting. Contraception, methods to prevent pregnancy. Premature ovarian insufficiency, if menopause occurs before the age of 40 years. Also sometimes called premature ovarian failure. Incontinence, involuntary loss of urine. Prolapse, feeling of something coming out of the vagina. Endometriosis, defined as endometrial tissue lying outside the uterine cavity. Endometrial polyp, are focal endometrial outgrowths containing variable amount of glands. Stroma and blood vessels which influence their macroscopic appearance. Fibroids, benign tumor of uterine smooth muscles termed leiomyoma. Adenomyosis, disorder in which endometrial glands and stroma are found deep within the myometrium. Dyspareunia, pain during or after sexual intercourse, which can be classified as superficial. Affecting the vagina, clitoris or labia or deep, with pain experienced within the pelvis.